How dangerous is the current spread of COVID-19?
The Health Ministry stressed as the spread of the COVID pandemic has increased, more serious attention must be paid to the current situation in the country. 66 COVID-19 related deaths were confirmed for Wednesday, the 28th of July, while 2,370 patients were identified yesterday. During the past few weeks, the daily tally of COVID-19 infections reported in the country were below 2,000 cases.
Doctors have warned that the number of COVID-19 patients are increasing. Patients with symptoms are increasing and the space viable to treat them in hospitals is also at a critical level. The threat of COVID-19 has not passed. The Delta variant has been identified in many districts of the island. As the spread of this variant is faster, we can presume that the number of Delta variant cases in the island will increase. We are receiving reports that even people who have received both doses of the vaccine have contracted the virus. So the only way that this situation can be prevented is by following health guidelines.
What is the progress of the vaccination program?
The State Ministry of Production, Supply and Regulation of Pharmaceuticals said that the highest number of daily vaccinations were carried out in the country yesterday. 515,830 vaccine doses were administered yesterday. Meanwhile, over 500,000 people have still not been able to get the second dose of the Covishield AstraZeneca vaccine. A batch of the AstraZeneca vaccine is due to be brought down to the island tomorrow, and these jabs will be administered to those who have not received their second dose. Meanwhile, a research was conducted by the University of Sri Jayawardhanapura on the possible effect of the delayed administration of the AstraZeneca vaccine.
And we found that 93.4% developed antibody response against SARS-CoV-2 virus after inoculation of the Covishield vaccine. And also we found that 97.1% had neutralizing antibody. So we had about good 500,000 people who did not receive the second dose of AstraZeneca Covishield vaccine. We wanted to investigate the immunogenicity of the vaccine after 16 weeks. From this study we found that about 93% of the individuals developed they had antibodies even at 16 weeks and beyond. But the key finding here is the neutralizing antibody has decreased from day 28 to when it comes to 16 weeks by about 26.1%. And they can, when they get the second dose, there is a theoretical possibility that they will produce enough antibodies to give protection against different variants.
Covishield එන්නත ගත්ත පුද්ගලයන් මේ වන විට අවදානම් මට්ටමක ඉන්නවා කිව්වොත් ඒක සාධාරණයි.
විශේෂයෙන්ම ඩෙල්ටා ප්‍රභේදය
If we consider the Delta variant, they will only have about 33% of protection against it through just one dose. One dose does not provide adequate protection against it. It is essential that people receive both doses of the vaccine.
ලබා ගැනීම ඉතාමත්ම අත්‍යවශ්‍යයි.